Good morning, everyone, and welcome to our Safe and Calm webinar for July 28th. This is Deanna Mitchell with Leading Age Michigan. It has been a bit over 440 days that we've been struggling through this pandemic. And although things have improved a lot in our facilities since this past winter, we seem to still be facing a lot of challenges going forward. There's not been a lot of new guidance since our last webinar, but issues and questions remain. And so we will review the new and also revisit areas where there seem to be some questions and concerns that continue. One of the challenges for me, at least this week, was that both MDHHS, actually that was a couple weeks ago, and CMS this week, changed their data reporting websites significantly. So it kind of feels like with that and other changes in guidance over time, we're always trying to hit a moving target. I'm sure that a lot of members feel like that too. So today we're going to start off with our standard agenda. Dalton will be covering some of the advocacy highlights this morning. We will review the Michigan situation update. And we're going to discuss the new CDC guidance, of which there are several pieces, go over current issues with the blanket waivers, consider the OSHA standards a bit, because there is a comment period that has been extended to August 20. And there are some issues in the OSHA standards that are concerning some members. And then we will finish with a reminder about where our significant regulatory resources are to date, so that we can keep everybody, give everyone a reminder of what the requirements still are for facilities. So with that, I'll turn the presentation over to Dalton, our Director for Public Policy.
Good morning, everyone. I hope everyone's doing well on this Wednesday morning. On Monday, we had the opportunity to attend an event for the governor for fundraising with her. We had a minute or two to speak with her, which went well, and she was providing comments to the group. She spoke a lot about remaining politically engaged and the potential challenges she's going to face in the upcoming governor's race. And she also took a moment to highlight the amount of money that is coming into the state for the upcoming governor's election. Between all the candidates, you may have seen someone may be coming with $10 million in personal money, which is a lot of money for a governor's race. As an example, Rick Snyder spent $6 million. So this individual is talking about doing 10. The Michigan governor's race is going to be a nationally highlighted race coming up in 2022, and you can expect it to have a lot of money thrown at it and a lot of advertising and campaigning going on throughout the political season. An important thing to note, though, is that it's not only the governor, but the legislature is also shifting into election mode. About 18 months before any election, you kind of see the rhetoric and language changing around Lansing. You're going to see some of the actual policy making slow down while the election talk and campaigning goes up. So starting after they come back from the August break / right now, you're going to start to see a lot of fundraisers start appearing and a lot of the language change to more of that campaign speak that you see every time an election rolls around. So that event was good for us. It was nice to get some face time with the governor, and she is very aware of senior issues. So in big news, you may have seen the member update on Monday. Senate Bill 27 was signed by the governor. This is a supplemental budget spending bill, and this is the bill that contains the SNF revenue or SNF lost revenues reimbursement fund. I talked about it on the last Safe and Calm webinar, and that's going to be a $100 million fund in total. It is important to note that the department hasn't reacted to this law being signed, or this bill being signed into law yet. So we don't actually have the actual reporting process, but the bill itself does actually give us specifics around what kind of documentation you're going to need to submit and just exactly how much you'll be reimbursed. And so we'll cover that again in review, and we'll have some updated stuff coming here. So for the fund, a SNF provider can submit a report to MDHHS to cover lost revenues for the first 3 quarters of FY 2021. You'll be reimbursed $23 per Medicaid day in reimbursement if you have experienced a 5% or greater facility average daily census decline during the applicable quarter. So if during quarter 1 of 2021, your census is 5% or greater, or less than 5% or greater, I said that wrong, but you know what I mean. If you have experienced a 5% or greater average daily census decline when compared to your average daily census on your 2019 cost reports, you will be eligible for these funds, and you do have to submit a report at the end of each quarter. It's important to note some flexibilities have been provided. A facility can be eligible for 1 or all 3 quarters, so you don't necessarily have to meet the 5% census decline for all 3. You can be reimbursed for just 1. And any provider who does receive these funds will be required to pay any reconciliation or determine payments or recoveries that the department determines at the end of the process in December. So on the next slide, we have a little bit more about the documentation you're going to need to submit. As I said, you can request reimbursement at the end of each calendar quarter. And while there may not be a reporting process right now for you to actually start to submit your report, it's important to note that you can start gathering some of this information in advance. So the information/documents that are required for submission, you can see listed here. I'll go over them briefly. You need your 2019 Medicaid cost reports based on total licensed beds. You need the applicable quarter's average daily census. So if you're applying for Q1, for instance, you'll need that average daily census. You'll need a detailed weekly average daily census for that quarter. You'll also need the number of Medicaid days rendered in the applicable 2021 quarter, including ICO and Healthy Michigan Plan days of care. It's also important to note that the department has been given some leeway to request any additional documentation. They haven't issued the formal guidance for reporting or submitting your request. So once we see more information about that, we'll let you know if they require anything else. But we do know the bill specifically says you need these 4 pieces of information to submit. Once you do submit a report, MDHHS will have 14 days after receiving a complete request to remit payment to you. The fund needs to be reconciled by the department by December 31st, 2021. So we are recommending that you do try to have everything into the department by December 17th. That way you avoid any kind of timing issues on the department's end, and you'll have a clean application process. So I believe that's all for me today until a little later. So are there any questions?
All right, thank you very much, Dalton. We do have one question, so let me pull that up really quick. Has there been any discussions about assisted living communities who also lost revenue due to COVID?
Yeah, we have mentioned that. They seemed pretty focused on SNFs. Just the other day, they learned what long-term care facilities encompass a couple months ago, even though we have been talking to them repeatedly. So it is something we keep bringing up, and there's certainly more funds available. So it is something we are going to be pushing for in the go forward. From our perspective, the legislature needs to understand that there's more to long-term care than just skilled nursing.
All right, thank you very much, Dalton. And then I did just want to show everyone, or remind everyone, I guess I should say, before we do move on to the next section, that we do have, if you head on over to our Leading Age Michigan website, if you go ahead and load it up, you will see this banner pop up. You can go ahead and click on that banner, and it will take you to our landing page, which you can click on conference registration. If you need to register yourself or some team members, you can go there and register. We also have exhibitor sponsorship opportunities. We have our prospectus if you are an exhibitor or sponsor and need a little bit more information. We have a schedule at a glance if you are interested at that. So there's a lot on this page that you can go ahead and check out. So if you do need to register, as mentioned, go on and head on over to the Leading Age Michigan website, and we have everything open for you at this time. I do have one other question that popped up really quick, Dalton, and it is there a website we could go to?
For the reporting?
That would be my assumption, yes.
None of the reporting requirements or process has been released yet. This was signed into law Monday, so the department hasn't reacted yet as to how they're going to handle this process. I would imagine it'll be an email submission process similar to other reimbursement processes, but we are still kind of waiting for those details to be announced. And we'll have a member update the day of when those do get announced, so that way you can start applying for these funds.
All right, sounds good. I'm not seeing any other questions, so we can turn it over to you, Deanna.
Okay, so moving on to the situation update. As we look at some of the data, this CDC graphic speaks to the current transmission of the Delta variant. The stacked bar graphs at the top show the variant proportions over the past 3 months or so. So the Delta variant is in the orange bar, and you can see that it's the cause currently for most of the infections in the U.S. The lower part of this graphic is the U.S. map divided into CMS regions. And you can see that there are a few regions where the Delta variant is a huge factor in transmission, but there's a lot more diversity in other areas, especially in the Michigan Region 5 area, and especially the North Central and Northeast. One of the things that we do have to remember, though, is that the public health officials can only determine the presence of the variant through PCR testing, not point of care testing. And the labs have to submit their PCR tests to the state for genetic sequencing. So recently, the department has called out the lab to submit more of the PCR tests because we know that most of the testing done in nursing homes is through point of care. And because of that, the number of actual Delta variant cases in Michigan is thought to be much higher. When we look at the Michigan 7-day rolling average, we can see that cases are increasing here over the past week or so, but not as dramatically as in a lot of other states. Cases have gone up to about 440 per day as of yesterday's reporting. And again, it is a bit of an increase, but comparatively low when you look at the rest of the nation. There's also a slight uptick in deaths, and although we know there is a lag period, deaths will always increase a bit with higher transmission rates, so that's rather to be expected. Here is our updated grid showing the CMS county positivity rates over time. We currently have one county, Gogebic, that's in the red category. 2 other counties are in yellow. And the rest of the state is still at a low transmission rate. But remember, this is based on the CMS county positivity rates. The CDC maps that we'll show you in a bit look a little different. So as I said earlier, CMS has significantly changed its nursing home data website. I have added the new link to this slide. And once you get there, you'll find that you can no longer access archived data for the county positivity rates. The arrow on this slide points to where you can access the most recent report. And you have to scroll down to this piece. It's in the middle of the page. So you can get the current county positivity file through this link. So there are a couple places where it looks as if you could find the archived data. This is one of them toward the bottom of the screen. When I first looked at this, I thought perhaps they had just not made the links live yet for those older periods. but we actually contacted CDC, and they say that the archive data is no longer available. So they're suggesting that providers download and save each new file weekly. On this slide is the CDC county transmission levels for Michigan as of 2 weeks ago. This was the most current status when we did our last webinar. And here, like if you click on the next piece, you'll see the most recent map as of yesterday. You can see that most counties have moved back into moderate transmission levels. There are 2 counties in high, and all of those orangish levels are in substantial transmission level rates. So you can see that things are changing a little bit, and we are seeing more transmission in specific areas of the state. When we look at SNF caseload as of yesterday, it's hard to see because the numbers are so small, but cases are increasing again slightly. And there were a total of 13 cases in nursing homes last week. There was a small increase in HFA cases as well, although they had been really low and 0, I think, a couple of weeks ago. They're now up to 3. And there were 4 cases in AFCs during the past week. Here's the table with the entire set of long-term care cases and deaths that we update all the time. You can see that we're over 48,000 cases across the entire period of the pandemic. What's a little disconcerting is that we still had 4 deaths across the facility types in terms of for residents in the past week, and a total of 20 new cases. And here's our updated slide from CMS on vaccination rates as of 7/21 reporting, because there's always a lag. Michigan had an overall rate of 79.43 for nursing home residents, and that is about 3 percentage points higher than when we last did the webinar 2 weeks ago. However, sometimes rates improve simply because the census, your resident census, may have decreased. And we would only know that if there were actually more vaccinations, if we had the raw data to look at. But at any rate, a slightly higher proportion of current residents are vaccinated than 2 weeks ago. The same is true for staff vaccinations. It is about a 1.5 point increase since 2 weeks ago. But note that for both of these graphs, Michigan does sit in the lower third of states for both resident and staff vaccination measures. Our final data slide was something I found yesterday on the CDC website, and honestly, it was a bit concerning. Michigan and the Northeast and North Central states are still comparatively better than other states when looking at new cases. The grid shows you that this color map looks at 2 different variables. It looks at vaccination rates compared to caseload rates. And obviously, the problem areas are marked in shades of red to purple. So if you go to that grid, it's the far right side that tells you where there's high areas of transmission. So red counties are highly clustered in the south and the west. And what is a little concerning to me was the purple area. So as you move up the grid, the higher the county vaccination rates. So those purple areas are counties with both a high vaccination rate and a high transmission rate. So I'm not quite sure what's going on there, but it's certainly something to watch. So we will move on now to resources and guidance. Pretty much only the CDC guidance is new, although there are a couple other new notifications. But as I said before, we will be going over very briefly other topics that continue to be problematic or we get a lot of questions about as well. So on Monday, as early as Monday, the CDC put out this guidance for the public who are vaccinated, and it's called When You've Been Fully Vaccinated. There were no surprises here at all. You must follow local requirements. If you're at special risk, even though vaccinated, you should be taking additional precautions. There's no need to quarantine after an exposure unless you have symptoms. And they continue to identify that there's no clear way of knowing how long vaccinations will be effective in keeping persons safe. And the link is right there. Then late yesterday afternoon, after holding a press conference, the CDC came out with a new recommendation for fully vaccinated persons. And the point of this was updated pretty much to consider the recent spread of the Delta variant and the fact that some persons with vaccinations were becoming infected. Not a lot of them, but some of them. And so the CDC is now recommending masks in public indoor settings in areas of substantial or high transmission, or if you're at risk. So if you go back to that Michigan map we looked at a minute ago, you'll notice that those orange counties are in substantial transmission. So that's a consideration there. And again, we had those 2 counties in high transmission. So they are encouraging universal masking for all school participants, regardless of vaccination status. And they also note that this new guidance does not change any of the recommendations for healthcare. Independent living facilities might want to consider this. However, as we will talk about in a minute, the guidance for those congregate settings, independent living, residential kinds of settings has not really changed according to the CDC, at least not as of yet. Governor Whitmer yesterday immediately commented that there will be no changes in the Michigan mask mandate at this time. The CDC listed several other pages as revised when we went and looked over the last 2 weeks. The retirement and shared housing page, I think it was just perhaps redesigned because in looking at it, we couldn't find any real updated content. But it does identify, it puts all the links to several of these topical areas all on one page. So that is, again, we couldn't find any content updates for any of these, but you do have access to all of the requirements, or they're at least recommendations from the CDC from this one page, which is the first link at the top. The guidance for adult day services was also updated, but and there were real updates there, but there wasn't really anything very remarkable. They continue to promote vaccinations, of course. The rest of the recommendations are really not much different than what we are currently doing in other settings. They do talk about how to loosen things up for persons who are vaccinated and the precautions for those that are not. They do talk about indoor and outdoor mask usage. And for adult day centers, the link here is on the slide. This, and I certainly won't read this to you, I copied this verbatim because this is the response from the CDC when I asked again about pets in nursing homes. We've asked several authorities over time and we've never gotten a good response. They say that there's a little risk of COVID with pets, although a small number of pets have been infected after close contact. There's only consideration about hygiene around animals. So there's really no discussion about the safety of bringing an animal into an individual resident or, again, allowing pets in the facility to roam from resident to resident. That's still a concern. Again, there is no guidance about this. There was none from MDHHS, so it appears at this point to be up to provider judgment and looking at your own situation. Over, I would say the last month, maybe two, we've been getting a lot of rumors about facilities, not necessarily member facilities, but facilities who have pretty much stopped all precautions for COVID. And we've known for a while that there's a lot of inconsistency in practice out there. So we will continue to review what the actual requirements are for members with a focus on any problematic or questionable areas that have come up over time. So none of this is new, but just to make sure you're all aware, for all residential settings, including unlicensed settings, assisted living, MDHHS still requires adherence to QSO 2039, also known as the visitation guidance. That memo references CDC requirements for testing, outbreaks, staff travel, etc. So all of those things still apply to all of these settings because MDHHS identified that in its May 21st executive order. And the link for that is there as well. The only difference between the May 21st order and the CMS requirements is that MDHHS voiced very early a concern with treating unvaccinated persons who are in group activities differently from those who are vaccinated. So according to the CMS guidance, you could have a table with vaccinated persons who don't have to mask, who don't have to distance. But if you had unvaccinated persons in the room, you could move them to another portion of the room and require masking and distancing. But according to the state, if you have any unvaccinated persons in that room, everybody has to distance and everybody has to mask because they don't like the idea of allowing different levels of precautions for different persons. The MDHHS March 5 testing order governs the testing requirements for nursing homes, homes for the aged, and adult foster care facilities that have been licensed for 13 or more persons. This order, as it's written, is also repeated on the long-term care resources section that MDH has under testing. However, there is still a link on that site to an older testing order that still refers to using the MySafe Start map to determine the frequency of testing. And several members have cited that as the current guidance, but it is not. So note that the state requires all unvaccinated persons to be tested weekly in all settings, regardless of local transmission rates. Nursing homes, in addition, are also required to follow QSO 2038. And the only difference in these state requirements is that you still have to do twice per week testing if you're in a red county. So right now, Gogebic and Branch counties should be testing twice weekly unvaccinated persons. Then there are the MDHHS recommendation documents. They're now called recommendations. So it appears that pretty much the rules themselves have been isolated in epidemic orders, although there are process and procedure things in some of the MDHH guidance, such as how to get paid for tests, etc. So these documents are meant to support the epidemic orders, and there's some FAQs included in them as well. So these give members some option ideas, but a lot of what's in the recommendations are also CMS and CDC requirements. So the only area of concern that we have with this one document is that their interpretation of the word limiting. The CMS and CDC websites state that you must limit visitation beyond compassionate care, because compassionate care is always allowed. But if someone is in isolation or quarantine and in transmission-based precautions, you're required to limit visitation beyond that. The state says that, you know, you can identify how you want to limit it, but we are sure that CMS means that you cannot have any visitation to persons in transmission-based precautions other than compassionate care visits.
Can you hear me, Deanna?
I can hear you now.
Okay. Are we still good to go? I don't know why I think we're good. I don't know. My sound dropped out.
Okay, so I didn't know if I lost power or what happened there. I don't know where I left off. I mean, I'm on this slide, which is, I think, 32. So what?
I don't know the number.
The
Okay.
last thing I heard was compassionate care visits.
Okay, well, all right, then we're close. So let's go to slide 33, the next slide. So this is a continuation of some of their FAQs. Obviously, you cannot deny visitation for compassionate care, but you have to remember that according to the state, it has to be, the need for compassionate care needs to be determined by a licensed clinician. And they do state that guidelines for masking and distancing for employees apply to all, regardless of their position. But remember that there's also detailed guidance in the OSHA and CDC requirements about that, about situations where everyone's vaccinated and there's no expectation that anyone in the room would be COVID positive, that you can apply as well. So the last document to consider in terms of figuring out what the current regulations are is the HFA AFC FAQs. They've not been updated since June 21st. And at that point, there was actually a little new there. One of the issues, though, that they did make clear is that MDHHS considers HFAs and AFCs as a healthcare facility when looking at the MyOSHA and the OSHA rules. So you should consider yourselves covered under those rules as a healthcare facility. Another issue, masks are still required for vaccinated and unvaccinated persons indoors in these settings, although the QSO has identified some exceptions. And they also note that staff to resident ratios are expected to be maintained during the pandemic. Okay, so I'm sorry for that disruption a few seconds ago. Do we have any questions at this point?
All right. We do have a few questions, so I'll just hop right into those. Can you validate that Michigan will mandate the transfer of all COVID positive patients to a designated center, care and recovery centers that have been appointed by the state to provide care to confirmed COVID-19 cases?
The last time I talked to the state about this was probably about a month ago, and they confirmed with me that the rules for using care and recovery center or a COVID relief center still apply. However, when I looked on the website a couple of days ago, there's only 10 left. And I have a sense that some of them are reducing their beds. So I do think that there's going to be some tension there, especially if cases start to increase again in nursing homes. So we can reach out to the state to see what their plan is. But the last I heard formally was that you are required to be designated to in one of those two different levels in order to care for COVID positive persons in your facility if you're a nursing home, not necessarily for other settings though. Blake?
Oh, okay. Yep. No, I'm here. Are the CDC recommendations, or do you think we will be held to following them? For example, fully vaccinated staff in non-care areas are not wearing masks. if we are in a high transmission area, should we now be requiring them to wear a mask inside?
Okay, well, I'm a little confused by that. My understanding is that if you are moving about the facility and you're a staff person, you are meant to have a mask on at all levels of residential care except for independent living. And staff are required to wear a mask for, I think, for all care really at this point, unless they are in a meeting where everyone's vaccinated and there's no one there expected to be COVID positive, or a break time. So I will go back and look at that again, but if you look at the QSO, the masking and distancing for staff has not really changed. Although I have heard different practices from members over the last several weeks in a lot of different areas. Those requirements are still there. And if someone, if somehow or other I am mistaken about that, please send me a link and we'll certainly look at it and talk with it and update everyone.
Okay. Are there any updates to the quarantine recommendations for staff who are traveling?
No, I was considering reviewing that today, but I kind of had more material than I wanted already. There have been no changes to that. And in fact, in a call with Leading Age yesterday, they referenced the fact that persons who are unvaccinated, staff, are still supposed to be quarantined for 10 to 14 days after return from domestic travel. And they rely on the 14-day rule, not even just the 10-day rule, because they believe that working with persons in facilities that are of such high risk would warrant a 14-day quarantine. So there have been no changes. I have not heard from MDHHS but recently about this, but I would say maybe 2 months ago, they were saying that they were applying that CDC guidance as well.
Is there an indication as to when vaccinated staff will be able to be unmasked when outdoors with residents?
Technically, right now, they are supposed to be masked at all times when working with residents. I really can't anticipate that. To be honest with you, we're looking at slight uptick in cases, even in Michigan, although very low. But considering what's happening around the rest of the states, I'm not anticipating any changes that would lower the requirements at this point unless something changes.
Okay. Does a licensed clinician have to be an NP or doctor? Can it be an RN, LPN, or a social worker?
I've been waiting for that question, and no one's asked it until this day. It doesn't say, and so I would use my judgment. I think a licensed clinician, I would consider myself a licensed clinician. I certainly think that the determination of the need doesn't require a physician, and so I would take that interpretation, but it really is not stated directly anywhere in the guidance.
Any talk by MDHHS about the daily swab reporting backing off? It is very tedious.
I know. No. Actually, you know, the communications from MDHHS, unless we initiate them right now, are pretty few and far between. We haven't gotten any. We have gotten apologies about the data reporting requirements, but nothing more than that. We've not gotten any signals at all that say that either they're going to change it or the CDC is going to change anything either. And considering, you know, that cases are going up, I don't anticipate that they will change it. At least we would like it to be more streamlined and a little bit less cumbersome, but at this point it is not. And we have communicated that to MDHHS. But you know, they have system issues, and it makes it hard for them to just easily fix some of these problems.
Okay. OSHA guidance says fully vaccinated don't need to wear in an area where I'm sorry, this is written a little off. OSHA guidance says fully vaccinated don't need to wear an area where they don't expect COVID to be. So in our non-care areas like the business office, etc., we heard on an OSHA call those areas would not need a mask.
That's true. If everyone is vaccinated, that's true. But in patient care areas, you are expected to continue to wear masks.
Okay. Since the CDC says vaccinated people need to wear masks now, vaccinated staff in a meeting would have to wear a mask, correct?
No, not if everybody's vaccinated and you have no reason to believe that anybody who potentially has COVID is entering the room. You don't have to wear a mask. That CDC guidance that came out is really for the public. Is concerned that those public places are potentially infectious. And because of the concern that some persons with vaccinations have gotten the infection. But the trick about the Delta variant and the other variants as well is that it does appear that persons with who are vaccinated are not transmitting the virus. Some of them are getting sick, very few of them seriously so, but those are those breakthrough infections. But there's no data that suggests that persons with vaccinations are transmitting the virus to others. So if you have a group meeting that has everybody vaccinated in it, there's no reason for those additional precautions.
All right, thank you. It looks like that was the last question for now, so we can go ahead and move forward.
Okay. So we're going to do a quick review of the OSHA Emergency Temporary Standard. We did go through it several weeks ago when it first came out. Shortly after that, MyOSHA accepted it as the standard for Michigan as well. The comment period has been extended to August 20. So we thought that it would be a good time to review some of the more difficult areas. I do encourage, if you've not read this standard, you should go through it because there's a lot of detail in there, and we're not going to go through all of those details today, but we're going to pull out some of the highlights, basically. So one of the things to remember is that most of the requirements are currently in practice under CMS and CDC guidance. This standard was announced on June 10th, published on the 21st, and made effective at that time, but OSHA is not going to enforce the requirements until 7/6. So that's obviously behind us, except for a few things, the ventilation rules, the barriers, the training. Those were not required to be in place until 7/26. One of the things that they had to do was identify that a grave hazard existed. And so apparently they spent a lot of time after the new administration took office to identify how to consider that. So it really was kind of a long process, and a lot of persons have said, you know, this is a little much too late. But I think it came on the heels of the new administration. They wanted to make sure that employees were well protected. And it took them a while to do this also because their original work included every type of employer. So the Biden administration kind of pulled them back and said, you know, this is too big, just focus on healthcare. So they put out this temporary emergency standard. They have 6 months to finalize this standard. So even though it is currently in place and you have to be compliant with it, it is still pretty much more of a proposal for a final standard that will come later. So the comment period was, I think, sometime in July. They have extended it to August 20 because of a lot of concerns and complaints from providers. So that's kind of where we are in terms of implementation. So the go ahead, move it forward, Blake. Thanks. Okay, so there's an awful lot of resources on the webpage, and I would suggest to members that they use those templates. The webpage itself is linked on the previous slide. In particular, you might want to look at the emergency plan template and the sample training materials. In the guidance, there's a lot of detail on who is covered, but it's pretty clear that all long-term care residential settings are pretty much included anywhere where there's health professionals or health support activities going on. The guidance itself calls out nursing homes and assisted living as covered. Any health setting where all COVID positive persons would be screened out, in other words, not allowed to come in, are exempted. So like an outpatient office where you screen everybody and no one's allowed in who has symptoms and or who's COVID positive, those are exempted. But in these residential settings, even in those settings though, there's an exception for areas where everyone is vaccinated. And again, there's no expectation that COVID positive persons would be entering. Barriers, masks, and distancing are not required. And that was, I think, brought up in one of the questions we just had. So you have to have that written plan, and that's the basis for everything. And an important point is that you have to keep each iteration of your plan as it may change. The safety precautions that are required are pretty much in alignment with CDC and CMS guidance. You still have to cohort or isolate patients. You don't necessarily have to have a big unit according to them, but you do know that you have to, in Michigan, if you're a nursing home, you have to be certified as a facility able to care for those residents. And of course, you have to do all of the normal employee screening. And here comes the new and tricky part. If you have 11 or more employees, you must cover their time off financially. If they're under quarantine or under isolation, no matter how or when they may have contracted the disease. There are limits to required compensation amounts, and facility employers can use their PTO bank, if they have one, to cover that. Some facilities I'm hearing are placing employees in a negative PTO situation to do that. We've not yet gotten clarification on whether or not that would be allowed. We are hoping to get some better clarification about this when the final rule is issued. A lot of comments have gone to CMS so far, I know. You do have to also provide paid leave for getting vaccinations. There are also some notification requirements, and they're pretty much in alignment with current practice. There are staff training requirements, and again, we suggest you review the training materials on the website. And additionally, you have to inform employees of all their rights to these protections. And of course, as to be expected, there are prohibitions about retaliation for exercising any of these rights. You do have to have a log of all your cases, and we know facilities do. And you have to place them on a log within 24 hours of identification of a positive COVID case. And this log must be made available to any employee on request. Of course, de-identify, because you can't put any identifiers of persons who have contracted the disease. You can't disseminate that to employees. Any employee who's on the list has the right to see their own information, but they don't have the right to see anybody else's, of course. And employees have the right to see any of the emergency plans that have been developed as well. So those are some of the sticky points with the OSHA guidelines, but again, there's a lot of detail in there, and if you have not looked at them, I suggest you do so. It is possible to get a MyOSHA visit sometime. Generally, they are only related to a complaint, but we do know that complaints go to MyOSHA from employees sometimes, so consider that. We're going to move on now to the CMS blanket waivers. We're going to just be reviewing a few, actually 3 provisions in the waiver that have been questioned and concerning over the past several weeks. The first of these, of course, is the 3-day stay. At one point, we were hoping these would just simply become permanent, but there's been a lot of discussion among experts in the last 6 months saying that that decision might be premature. So we're not sure that CMS is going to go there. We were hearing that the 3-day waiver is going to go away. I was getting a whole lot of messages over the last couple of weeks from several different areas saying it's going away. But what was really going away was the end of the current emergency declaration. So that ended recently and then was extended again. So the waiver for the 3-day hospital stay has also been extended with the emergency declaration to mid-October. So at this point, the 3-day stay is still waived. However, we do know that CMS is closely reviewing some of these waivers, and we wouldn't be surprised if we didn't see changes in some of these waivers before the end of the next 90-day extension of the public health emergency. But we anticipate also that they're not going to stop everything without some notice to providers. Another area of concern is the time frame for MDS assessments and transmission. This is really confusing, and it was confusing to me as well, because although this is still waived, providers are still required to submit the data for their QRP measures. CMS based the FY 2022 rates on the second 2 quarters of 2020 because they had postponed the first 2 quarters based on this requirement here. Some members have received notice that they lost 2% of their Medicare revenue because of this. There is a reconsideration process, but it might be difficult to get this turned around unless you have a clear reason for your data delay. CMS did send out notices about the QRP last summer, but the continuation of this waiver statement on the system does make it confusing. The last area of concern in the waivers is the use of non-certified aides during the pandemic. There's a lot of concern about how we're going to transition out of that. And of course, this provision is still in place and is expected to be in place for 4 months following the end of the emergency. At least that's Leading Age's take. There is proposed legislation in Michigan to transition these persons. And so I'm going to turn it over to Dalton for a moment to give us a brief update about that. So Blake, you can move on to the next slide.
Hello again, everyone. So just to briefly touch on what's the proposed legislation here in Michigan, it was introduced right before the legislative break and had a lot of momentum behind it, and I was actually in testimony the day it was introduced, which is rare for a bill. It means it was moving quickly through the process. This is something that all 3 long-term care associations are working together to push to get across the finish line, so I do think this has a good chance of getting implemented. So we've discussed this a little bit last time, but I'll review it just so everyone has a fresh take on it for this conversation. So instead of the normal training program / exam process to register someone as a certified nurse aide, a temporary aide who's been working underneath the 1135 waivers will have another option. And so this person can become registered by completing the following 3 things. First, they'll need to complete a 16-hour course of in-person or online training taught by an RN. This course is required to cover the basic roles and responsibilities of a CNA, as defined in the bill. So this includes things like infection control, nutrition, hydration, use of care plans, the general things you would think that a nurse aide would be required to do on a daily basis. They would also need to complete 80 hours of on-the-job or in-service training, and then they'll need to be able to demonstrate competency. Normally that is done by taking the exam. They can still take that exam if they can find a testing location. But the bill also offers two other solutions in that a person could get an approval from a site administrator who has been responsible for assessing their competency as part of an internship program, or they can pass an assessment created by the hiring entity that covers the roles and responsibilities of a nurse aide that were taught in that 16-hour course. So it does give providers a little bit more flexibility when it comes to registering these temporary individuals. And as I said, the bill had a lot of momentum before the break. Obviously, during the break, they haven't been meeting, but all three associations are working together to get this done.
Okay, well, thank you, Dalton. You can move the slide forward, Blake, please. So we're going to end today with a few miscellaneous updates. We wanted to let you know that there's a bill in Congress called the Essential Caregivers Act. It amends the Social Security Act with the goal to ensure that residents don't lose access to their essential caregivers during a public emergency, as we know they did during early days of the pandemic. So in this legislation, up to 2 individuals can be designated by anyone, and they can visit for up to 12 hours per day. The legislation, though, lists some of the things that these persons would be doing, and one of them is ADLs. Obviously, emotional support and companionship makes sense. But there's a lot of concerns that we've heard and we've had ourselves about the ADL issues and liability and responsibility. So some input has gone back to the legislators looking at this, because there has to be some limits. There's liability issues. We do know that family members often assist with basic grooming and feeding activities, but there must be some things that they're not allowed to do. So just to say that they can do ADLs kind of puts everybody in a bit of a tizzy. So we are looking to see how this moves forward, and I know that Leading Age at the national level is conversing with the legislators about this. And I saved kind of the most dramatic piece for last. We know that there are no easy answers here, but everyone pretty much at this point must be aware that there are a lot of organizations out there, including Leading Age National, that are promoting mandatory vaccination. And that's an important piece. It's our feeling that members will be best served by looking at their individual situation and making decisions that are best for them. Unfortunately, though, we do know that pressures may mount if caseloads start to rise significantly in residential care facilities again. So there is that issue. So that's all we have for today. I want to remind everyone that we have invited Plant Moran to be with us next webinar on August 11 to review the provider relief reporting requirements. So if you have questions about that, please plan to attend our next Safe and Calm webinar. And Blake, do we have any final questions?
All right, thank you, Deanna. We do just have a couple questions here. Is there any word from MDHHS regarding relaxing the requirement to quarantine new admissions for 14 days if admitted with a negative test?
No, and either has the CDC or CMS. Right now, the only way to avoid that is if you're fully vaccinated. A negative test alone won't do it. And of course, the philosophy behind that is that a single negative test doesn't really mean that you won't get the disease within a couple days later if you've been exposed before admission.
Okay. Do you have a link where we can provide comments regarding the OSHA ETS?
I do, and I'm sorry, I don't remember. I must not have included that. I will provide it out. We will provide it when we send out the slides in the program.
Okay. With that, I am not seeing any questions. So as always, if anybody does think of anything after the webinar has concluded, you can always reach out to the Safe and Calm Dalton or Deanna at leadingagemi.org, and we will make sure to get those questions answered. Also, as Deanna mentioned, our next webinar will be 2 weeks from today, so that will be Wednesday, August 11th. So make sure you come and join us again for that. And now with that, we would like to thank Dalton and Deanna, and we would also like to thank the 75 other members and participants that took time out of their busy schedules to join us for today's webinar. We appreciate everything you guys do each and every day to support your staff and provide quality care to your residents. We are grateful for your continued support, and we are here for you when you need our assistance and resources. With that, that will be the conclusion of today's Safe and Calm webinar. We hope everyone has a great remainder of their Wednesday, and we will talk to you soon. Thank you.
Take care, everyone.
Have a good day.